Greetings. I am Tom Earl. I know you could be anywhere, so the fact that you are here today sharing your greatest gifts, your time and energy, it means the world to me. I hope you know that in this moment you are valued, you are loved, and you are appreciated just as you are. My friends, I have a new series for you. This is called the Listening Deeper or the Re-Listen series. You can call it either one. I know I am. Now, you may have heard this intro before. We are using the same intro for this series. So have no fear if you're listening to this again and thinking, oh, I've heard this episode before. Don't worry. Same great intro, absolutely amazing new podcast. So feel free to hit the skip 30 seconds if you've heard this before. But if this is your first time hearing this, welcome, my friends. What we are presenting to you over these next episodes is really some deeper listenings or some re-listens to some of our most requested, some of our most listened to, some of my favorite episodes that we've done. Now, we have put out over 300 episodes since this has started. That means all the way back to 2016, I've put out one episode a week, every single week without fail since 2016. That means there's a lot of really awesome interviews, solo episodes. There's some really great things in there that you probably haven't heard if you're just joining us, or even if you're a longtime listener. So what I want to do is pull together a number of my favorite ones and your favorite ones that you have listened to or that have been listened to before you. And I want you to either hear them fresh for the first time or give them a re-listen yourself. I'm telling you, I have re-listened to each of these and really just thinking about where I was in my life then or the wisdom from then that applies to now, because some of these are going to be from 2016. Some are going to be from last year. Some of them are going to be, weeks before everything that went down in 2020. So I want to share these with you as a gift going into the time vault of our episodes. And really, I invite you to go through these with new ears, with new hearts, because we are new people here in this moment. Now, I invite you to let me know if you listen to it, what year do you think this week's episode was from? And I'd love to hear your thoughts, my friends. I look forward to sharing this Listening Deeper as we re-listen series with you. Let us jump into this week's re-listen. Here we go. Greetings, I am Tom Earl. On this week's episode, we talk doulas and advocacy for Black Maternal Health with Iman, Nicky, and Deej. Check it out. Woo! As you can see, I am not alone. I have three amazing guests joining me today. They go by the names of Iman Seraaj, Nicky Dawkins, and Deej. What's going on, y'all? How's everybody doing today?
Awesome. Good, thank you.
Hey, I am so honored to have everybody here. Really looking forward to the conversation we're going to have. So just want to start off the gate with gratitude. So thank you so much. So who would like to be bold and go first and share with the GOAT folks listening about yourself, anything you want to share, anything you want to go into in the intro land? Who would like to get us started?
So, hey everyone, my name is Deej. Like he said, I am a 26-year-old mother of three. I'm from Philadelphia, PA. I am a certified doula. I've been a doula for 3 years now. I am a childbirth educator and a breastfeeding specialist. And I'm a former nurse and now a stay-at-home mom. So I'm kind of juggling a lot right now. I have a 7, 5, and 2-month-old. So thank you guys.
Awesome. Thank you. Who would like to go next?
Hello, I'm Iman. I am a certified full spectrum doula. I have been working and living here in Montgomery for many years. I was certified back in 2008 and have been practicing since then. So it's been almost a little over 12 years now. I live here in Montgomery, Alabama. And yeah, that's pretty much it.
Wonderful. Nailed it. Thanks, Iman. It's always great to see you. And Nikki.
Hi, everyone. My name is Nikki. I am also a full spectrum holistic doula. I'm based in Miami, Florida. I have a 5-year-old son. I'm entering actually my 5th year of doula work as well. I became a doula after having a doula, which is common. And I'm also a feminine health coach and period activist. I am the president of Period Miami, a charity down here in Miami. I'm also part of the Period Movement national team and vice president of the Miami Diaper Bank Board. So I'm very into advocacy and charity work in addition to my doula work, and I love periods and feminine health in general. Nice to see you guys.
Awesome. Thank you, Nikki. So team, for the folks who are listening, what do you think are some words or phrases that were used in your intro that maybe might be new to folks that we should break down as we get going to kind of have some shared language or shared approach? Where do you think we should start? What do you think is one that maybe sticks out that we should jump into?
Maybe the full spectrum doula. I get a lot of people like, what does that mean? And I know for me, it means a lot to different people because there's so many of us that do a wide variety of things. For me, I do everything from fertility all the way through to postpartum and kind of everything in between. I'm trained in pregnancy and infant loss as well, and prenatal and postnatal fitness. So it's very broad. And then everything period related too. So I think that's a good one.
Anything y'all want to add on, or that nail it?
Well, for me, for full spectrum, because like she said, that it can mean a wide variety of things. I was trained and specialized in everything prenatal, birth-related, postpartum, and breastfeeding. So, and that's it. I really am interested. I'd like to talk to you maybe later. I'll follow you on Instagram or something about being anything in infant loss and fertility. Those are really interesting. But yes, those are what full spectrum means for me in my practice.
And Deej, what about for you?
Yeah, just to piggyback off of what they were saying. Same thing. I feel like it's a very wide variety of what it means to be full spectrum. I feel like my strengths are in childbirth and breastfeeding. I feel like that's where I get a lot of my clients. But I have had clients where I dealt with infertility issues and loss. So I feel like it's whatever you feel is like your wheelhouse of what you can offer someone. So yes.
You know, I feel like those are infertility and loss are two of the areas that are rarely talked about or shine light upon. So maybe let's start there. What is the conversation that we should be having around either of those? And maybe you want to tackle them separately or together. Where should we start? Or what are the conversations that you think would bring healing or awareness for us to start on?
Sure. I think it's really hard for women to be vulnerable in general, especially around this topic of childbirth, because it's kind of an expectation that comes with being a girl and having a uterus, is that we're supposed to be baby makers. And it's not the same for everyone. A lot of the language that is used and the questions that people ask can sometimes be very devastating to people who are having trouble conceiving a child, or people who choose not to have children, because the type of loss that I deal with isn't just medically necessary. Sometimes it's a choice that they're making for their lifestyle. And I think there's a lot of judgment that comes with that. And I think it's very important to remember that not everybody walks the same path, and we all have different lifestyles and things that happen to us that, make us make these decisions. So I think it's just important to kind of open the conversation, talk about miscarriage, talk about fertility, talk about abortion, because they're all our right and our choice. And sometimes it's not our choice, but you have to be very mindful, I think, of that. And I think it's important for women to just talk about that more and put it out there, and also just feel no shame about it.
Yeah, I agree with Nikki. I think it's so important that we start to have these conversations. I've seen a post recently where someone talked about the amount of women who buy the first response pregnancy test, or more so women who are dealing with infertility. When you don't deal with infertility, you go out and buy one test, right? Because you know that you're pregnant because there's no other reason you're having these symptoms, where these are women who are constantly thinking that they're having symptoms and they're buying test after test after test and spending a huge amount of money to get a big fat no. So I think it's something that we should talk about and we should highlight and have more conversations about, because there's a lot of women out there who feel a lot of shame that their birth experience or their getting pregnant experience is not universal. It's not like what they see online or what they see on TV. You know, you go make a baby, take a test, and then you deliver a baby, and that's it. It's so many different steps that come along with people who deal with infertility. So I love these type of conversations because we can include these women who need the support.
I agree with Nikki. I really loved what you said about mindfulness. And I think that's very important when we're having conversations around infertility and loss of pregnancy. And I think that it's great that more people are talking about it. You know, so many women deal with a miscarriage and we don't often talk about it until after the fact. And I think that now more women are speaking up. And even if you want to, you know, add in celebrities into that conversation, and it's making more women brave enough to tell their stories. And I think that's really powerful.
A word I was hearing a theme through was the shame or maybe secrecy or maybe even aloneness around infertility or loss. What do you think is the step or advice or insight that you'd share with somebody who maybe is feeling shame, or that this is something that they can't speak about to anybody? What would you want to share with them? Maybe if they're listening or they know somebody who they might want to share this with.
I think, you know, it's very dependent on the person. Sometimes the shame that we experience comes from family, it comes from friends, it might come from our culture, it might come from religion. There's so many different things that can cause us to feel shame. So I think it's really important for people to just know there's people like us out there. There's doulas. So maybe if somebody's not in your immediate circle, that there are people that you can reach out to, not just doulas, but therapists and, you know, all kinds of advisors like that are outside sources. I know that it's not, even within our world, I feel like loss and fertility is not always something that we bring up. And I think it's important that we have that service out there more as well, so people can take advantage of that and get the help that they need.
Yeah, and I would just tell them that it's normal. This, what you're feeling, is not something that I want you to feel is something you need to be ashamed of. We all experience things when it comes to childbirth, pregnancy, bringing a baby into this world. So the emotions that you're feeling, don't shun those feelings. Don't turn away from those feelings. It is okay to feel how you feel about wanting to have a child and experience being a mother and a parent. So I just always try to celebrate people in their mental, that it's okay. Like, go into those feelings and express those feelings. If you want to write it down in a journal, if you want to talk to someone, if you want to find a support group, do the things that you need so that way you can feel okay about how you're feeling, because it is very common.
I second what Deej said, especially when you think about how common miscarriage is. Been, like we've all said, that people aren't really talking about it. So when we do talk about it, you realize that you're not alone in how you're feeling, and that you're not alone in your experience. You know, so often we want to sugarcoat everything with the positive and beautiful side of birth, and here's our babies, and here's our pregnant and beautiful bellies, and all of those things are wonderful. And then people think that they can't share the sorrow that they have. And so it's important to show the whole full spectrum of it.
Well, we've got a chance to hear from each of you, and we know your specialties. Is there anyone here that's curious to ask another guest a question from something you've heard or hearing about your specialty? Just want to give space if y'all had a question for each other that you wanted to drop in.
Well, I am interested in being like with infant loss and being in doula being a doula for women who've lost a child or are experiencing losing a child. I know for me personally, it's a fear of mine, and I only can, by the grace of God, I haven't had a client yet who's lost a child. I've usually women come to me after they've experienced a loss and maybe they're pregnant again. So, but it is, and I do want to get over that fear because I know it's just, just a personal fear of confronting someone who's had a deep loss. And even though I've experienced that myself and I know how I felt, and sometimes whatever anyone said didn't really help me. So, and then I wouldn't want to take that to another woman. So I really am interested in that, Nikki. If you could talk about that.
Sure, no problem. I mean, what you said is exactly right. A lot of times when people have a loss, people do tend to say kind of the wrong things, and maybe we feel like we're saying the right thing, but it's not exactly what the person wants to hear. And I think kind of to what Deej said is we really have to allow them to live in that space of sorrow. Saying things like, oh, you can have another baby, or, oh, it's going to be okay. Sometimes it's okay to be like, it is not okay. And the way you are allowed to feel the way that you feel and mourn this loss. And you kind of just have to guide them along through the sorrow and really hold their hand, which I feel like most doulas are very empathetic, and that it can be really challenging because you really feel, especially I think we're all moms here, I've never experienced a loss, but I'm pretty good at putting myself in other people's shoes. And I know, how would I feel if this were me, and what would I want people to say to me and not say to me? And sometimes as a loss doula, silence is golden. Sometimes not even saying anything is so helpful. Just having your presence is very powerful for people. Holding hands, giving a hug, and just breathing with them, which I end up doing a lot. I'm like, let's just not do anything and just be in each other's space. And if you feel like talking, you say something. And a lot of times I don't even reply. I just let them vent in their own way. And I think a big mistake that people make with loss is feeling like they need to fill all the gaps, right? You want to say all the right things, but sometimes saying nothing is the best thing that you can do. Yeah. But don't be afraid of it, because, people come to you after a loss for a reason. They obviously feel something about you and feel comfortable with talking to you about it. So just hold space for them. And then remember after, because I always have a good cry once they're gone, and I have to journal, or I have to meditate, or do what I need to do to kind of, because it's hard as doulas, we hold so much space for people all the time. It's such emotional and powerful work. And we also need to give ourselves a break as well. So that would be my advice, is to prepare yourself and then be there, and then give yourself your own time to grieve as well, because it's a loss for us too. We normally feel what our clients feel. So
thank you. That was beautiful. Thank you.
Well, I can add on to that. So my wife has given me permission to share this. We've shared it on past episodes together. So we have a daughter, her name's Jaima, and she started off as a twin. And so we early on lost one of the twins. And what was really hard is when the few people that we did share it with, like you were saying, really wanted to right away go to, well, look on the positive, you still have one of the babies, or it's just nature's way of getting rid of a baby that's not ready. And it's like, we just wanted to grieve and not have to go to the positive. Of course we're going to get there. But so I really resonated when you were saying that. I think when I'm thinking back, what would we have wanted is just someone to just kind of sit there and let us carry it with them. So that resonated with me. So thank you, Nikki. I appreciate that. So, one thing that's different for when I was growing up, I think so much of growing up has been realizing the myths of pregnancy and all of these things they used to teach us when we were little. It's like, you have sex once, you're instantly pregnant. 9 months later, without any hiccups, baby's here, it's perfect, no worries, everybody's celebrating. And my journey with the people in my life has been so different. But one thing is that the rest of my family can't relate to. Since my wife is Black, my biggest worry when she's going through her pregnancy journey is that something's going to happen to her. And I know you all know this, but a lot of listeners might not know that there's such an inequality of the health of Black women while they're pregnant. And I was wondering if anyone here would be able to speak to that in any way for those listening who do know or who don't know, to also have that conversation.
Well, not just while they're pregnant. It starts really from the very beginning. So even before and after, there's all these hurdles of possible, I don't want to say danger, but yes, because it can become dangerous, when someone is not being given the care that they need and deserve. So just in the disparities of education around prenatal care, the disparities in education around breastfeeding, the support that we get after we've delivered and are caring for our child, the studies that are coming out, they're very helpful to the wide society, but it can make so many clients come to me and they have so much fear because they're seeing all the studies. So they know that it's real and they may not have experienced that yet because it might be their first pregnancy, but they definitely want to not have to go through any of those things. And the people who love them are very nervous for them. So you're really not just being a doula for them, but for their entire family.
So I'll chime in because this is something that is really important to me. This is a part of my whole brand. Talking about Black mortality is everything I stand for and advocate for, against. And so when I'm talking to clients, and I'm always preparing my clients for what to expect when they are going into a hospital setting or they going into a prenatal appointment, to always be mindful, right? You don't want to say fear, but we have to be mindful that when we are in the presence of these individuals, they do look at us differently, right? They automatically think that we are less educated or that we are over exaggerating. And so when we request certain things or we bring up certain things, they're like, no, you don't know that. Or why are you asking these questions? Or you're just exaggerating. And so this is when the problems start to arise. So, and I always also go into the fact that it's not even a money issue, right? Because we have seen time and time again, story after story of women who, like Serena Williams, like Beyonce, who have unlimited access to finances or funds, get treated in the same manner. So why is that? Because there is implicit bias. So in the healthcare system, right? And even if they say, oh, I took an oath to treat everyone equally and fairly, it's still there. And they might not even understand why, but we can see from the statistics that women, especially Black women, are dying 2 times more likely than white women, right? There was the head of the public health organization, I forget his name, I'm drawing a blank, I'll come back to it, but he made a statement and said that Black women who are educated, have a degree, come from a great background, will still die more often than a white woman who have less than a high school diploma. So if that doesn't tell you something right there, that change needs to happen, then I don't know what will. And there are plenty of stories. I have a list of women that I always give out to my clients and say, hey, research these women. These are women who actually passed away following the delivery of their child. And the one that's always at the top is Kara Johnson. She's literally always at the top of my list. She went in for a routine C-section for her second child. Her husband and her were complaining after the delivery that she was feeling fatigued, and she was in a lot of pain following her C-section. And the doctors just kept telling her that this is normal. And she's telling them, no, this is my second child. I dealt with this before, and this is not normal, what I'm feeling. And one of the doctors looked her husband in the face and said, your wife is not a priority right now. And by the time they got to Kiara, she had bled out. So this is something that I'm always talking to my clients about, especially women of color, that we have to get the resources and the education we need when we are going into these facilities and we're trusting these people to treat us equally.
I will second what you say, and that was really well said, Deej. I totally agree with you. I think it is partly us not being educated, but I think the deeper issue is the healthcare system in general and what they're taught. They're not really taught where this is coming from. Because if you do, there's some books and some reading that that are out there, some great ones, Medical Apartheid, Killing the Black Body, a lot of really great titles that go into the history of where this mentality of thinking that we're stronger or that, you know, we can take pain better comes from that. And I think it's really implementing that education into those medical professionals' schooling that is going to change this. Because we, like she said, you could be the most educated person. And it's the same with birth. I have moms and I send them off and they know everything and will still get mistreated and overlooked. So the real problem is the healthcare workers and the people that are in that system and trained in that system. And I think that's really where we need to start, is changing their educational, you know, process and letting them know about this and where this is coming from. And hey, you need to overlook this bias because this is where it comes from. And I think that's what's really going to make the change. And until we start doing that, I think this will continue to be a problem. I think it's good to keep making our clients aware of it, but I think the change has to happen at the medical professional level to really have an impact.
What do you think is the conversation we should have to go to the next level in what we're talking about now, where we've kind of like touched upon it for folks who didn't know, or folks who did know are saying, yes, exactly. What do you think is like, how do we go a little bit deeper on this subject that we're talking about now?
Well, I'd like to know what Deej and Nicky how they feel about, you know, birth advocacy. That's part of the education that I do. And, you know, I'm part of a lot of different doula groups on Facebook. And of course, everyone's doula training, it comes from different places. But one of the alarming things I'm seeing is a lot of doulas aren't being taught to advocate for their clients. And I just want to know how you all feel about that.
I agree with you. I know for my doula training, and the reason I trained with who I did was because I've always just been an activist. I was already working in that field, and I really wanted that background of you know, advocacy as part of my doula training. So I do agree with you. I think, and I've spoken with some other doula organizations about implementing this training into their work, and also certain certifications that you can get. Like, for example, the prenatal fitness I did was with Fit for Birth, and this was something they completely skimmed over, and I had to bring it up to them. So I think it's kind of our job as well, when we see this happening, to be like, hey, just so you know, this is something that you should include in your program, and make these doulas aware that they need to advocate, and these are the reasons why. But I think that's a really good point. There's so many different doula trainings out there, and some of them really don't focus on this part. And I think for me, that's the main passion of the job, is the advocacy part, and making sure that our moms get the birth that they're looking for, regardless of their color. They should all be treated the same, no matter what their background is. So I think that is another thing, just on the same level of being an educated birth worker, is addressing the actual education that we're getting from these different programs. But whenever I have a doula that is looking for a mentor or wants to become a doula, that's the kind of the first thing I say is, well, find somebody that is going to teach you about the advocacy part, because that's really your main job, you know? So I think that's a really good point and a good question.
Did you want to add on to your question, Iman? Did you want to add, I mean, like, your own thoughts on it?
Well, no, I agree totally. You know, that's why I wanted to get other thoughts, because, you know, I see posts and I think right away, okay, well, what would I have done in that situation? Where's the advocacy? I don't see the advocacy happening within this story, where things could have really changed. And I just, it is alarming. And I think what it stems from is a naivety that people think everyone's getting the same quality of care. And of course, as Black women, we know that's not true. especially for just dealing with our own clients and maybe our own experiences, and learning how to advocate for yourself, to as a doula, to advocate for your clients and their families. I think it's very crucial, and it can be life-saving.
I would just, my what I'd like to add in that you've already highlighted, I just want to extra highlight from my own experience, is that money isn't a equalizer in this. So I don't want people to think when we say the same quality of care that you're thinking like, oh, some crappy hospital in a backwoods. The example Deej gave is the same hospital my baby was delivered at. Amazing, amazing hospital. So we're talking like top 5 hospitals in the country this happened at. So excellent care, but racist care. And when my wife and I would go in, when we were interviewing who was going to be the person who was going to deliver our baby, I would ask each one of them, hey, there's a disproportionate rate of Black women who die during childbirth. How are you going to be aware of that? And these were Black OBGYNs, and most of them were saying to us that only happens to poor Black women. And then it was like, of course, all the examples we just gave now, what about Serena Williams? What about this? What about that? And until we heard a doctor like take it serious, like, no, this is an institutional thing. And her giving examples of like, I had a Black patient and a white anesthesiologist was like not trusting. And so like I got in there and started fighting. And we're like, okay, that's what we're looking for. So I know we're out here in LA and we have the privilege of excellent health insurance and we're spoiled for choice in LA. So I guess, so for people who are listening to that and saying like, Tom, I don't have the option to interview 4 or 5 different Black OBGYNs in my community. I don't have all that choice. There's like, what would y'all be advice to people who are feeling like, I don't have the options that you're talking about, Tom, to even try to select somebody? What would you say? What could they do?
Well, that's where, self-advocacy starts, really just asking a lot of questions, just going through the gamut. If you hear something that your provider is saying that you don't agree with, question it. And then maybe you can get them on your side, or at least have a doula or have whoever your partner is going to be, always be with you when you're going to visits, and backing you and being able to back you up. So really having that second layer of advocacy and someone who can protect you or help you remember the questions that you wanted to ask. It really just depends on what they're saying. Like you said, you had doctors telling you that it wasn't a thing, or it was only happening to poor Black women, and, confront them with that. Say, well, okay, well, here's the evidence that that's not true. And if you don't have any other choice but to use that provider based on, your insurance or whatever, or location, then just always make note of it. Tell them like, well, I want you to make note of that this is what you said. Keep your own notes and just really be diligent.
Mm. Mm.
I love what you said too, because I think that location and again, like your insurance matters so much. I know so many people who are like, well, this is who I have to go with because this is who my insurance covers and I cannot afford to pay for this out of pocket, obviously, especially hospital. It's very expensive. But I think what you said is important, is to take notes. I always tell my clients to ask a lot of questions as well. And don't be afraid to ask them questions that maybe might make them feel uncomfortable. Like, what is your C-section rate? Or how many did you do in the last year? What's your average mom look like? Is she Black? Is she white? Like, those are the conversations that we need to be having. And even though they're a little uncomfortable, it is your birth. This is your journey, and it's so important. So I feel like you just kind of, again, have to advocate for yourself and speak up, or have somebody who's willing to do that for you, like a doula, or doesn't even have to be a doula. It might be your sister, your mom, your best friend, your partner, whoever, who can ask those questions. Because I know also from being a patient and as a mom, you also don't want to create a difficult situation for yourself. So it can be tough because then you end up being looked at as that angry Black mom or that crazy pregnant lady, and that can create problems for you as well. So sometimes, like she said, having that second layer or that barrier person to help you out is really important. And I think coming in with the questions you have in mind and doing it early is really important as well. The sooner the better, because you'd be surprised that sometimes you do have options and you can make changes and you just don't know. And I think as doulas, we're also a resource, and we might know something that you don't. So you might think that you're stuck with this doctor, but maybe we're like, actually, your United Healthcare insurance is, also covers this doctor. So I think it's important to just speak up about these things because we're so intimidated by this world and these doctors make us feel so disempowered that we kind of have to get over that hump. And by doing research, joining groups and figuring these things out on our own a little bit, and then finding allies who can help us along the way.
Yes. And just to piggyback off what Nikki was saying, I always remind people that doctors are in practice. I'm in practice. I'm always learning. So many times I hear people and the way that they talk about the doctors, like it's set in stone what they said. And even for me personally, just in other types of going to different types of doctors and asking the questions, and then me being more relieved for them to tell me, oh, actually, I don't know. Let me get back to you on that. I feel more relieved that you don't know and that you're going to get back to me than just telling me anything just because you're a doctor and you think I'm supposed to know everything. So I always remind people of that it's okay to question your doctor and don't be afraid of that.
And for the folks listening to the podcast that can't see us, if you're wondering, why are they ignoring Deej? Deej did not get voted off the island. Her laptop died. She texted me. She's going to try to get back on. So just so y'all aren't worried that we are not giving her a chance to speak or to share her voice. What about for folks who are looking for a doula? What advice would you share with somebody who's like, this is awesome. They answered all my problems as a doula. What next?
Interview. I always think it's important because your doula, we become family most of the time. I feel like I'm a very clingy doula and I never let go. I'm like stuck with you for life and you're never going to get rid of me. So I feel like it's important that you find someone you really vibe with, that really respects your choices that you're going to make for your birth as well, whether you choose to have a C-section or, you choose to birth at home or in a birthing center, whatever your choices is. I think it's really important that your doula is aligned with you. So I always suggest interviewing at least 2 or 3 more if you need to. Even after somebody has a great interview with me, I'm like, hey, don't be afraid to reach out to other people. You might vibe with somebody better. And I want everyone to have the best birth experience possible. So it doesn't really matter if it's with me or not. If I have a doula sister that does something that I don't do that you're looking for, I will refer you to her. So I think it's really important to keep your options open with doulas because as you guys have heard, we all do different things and some of us have specialties and are better in some areas than others. So decide like what's the most important thing to you within your birth and find somebody who's willing to advocate for you and support you through that.
100% what she said, really. I just sent a list of doulas that I know and trust to another woman who was looking for a doula, and I was like, well, let me send you this list, and if you want a midwife, let me send you to the Alabama Midwives Association website. So really my personal philosophy, because my sister was my first client and the person who inspired me to become a doula, it was really, at first it was just for her, and every client after that, I treat like my sister. I want you to have the most beautiful, wonderful experience that you can possibly have, no matter what type of birth it is that you're having. So, and any good doula feels like that. So vibing with them and aligning with them is very important. So basically everything that Nikki said. Yeah.
What are some misconceptions around doulas that y'all want to clear up or annoy you or don't annoy you, but you're like, okay, yes, let me tell you.
Doulas aren't midwives. That's
Go ahead, Iman. You go. I've been going. Yeah.
Well, the thing I get most is thinking doulas and midwives are the same, do the same job, and we do not. Midwives are amazing, so are doulas, but we have very different jobs. We doulas are, no matter if you're a midwife or a doctor or a nurse midwife, we're just there to enhance the experience really for your patient, client. And so we're all a team together, but we do not have the same job.
Yeah, I agree. I was going to say, I think a mistake people make is doulas are not clinical or medical professionals. That's not what we are. Again, we are there to enhance the process. I do think that we have a lot of knowledge and we should, and continuing education is definitely a part of our work. We have to always be on top of things, but we are not, we can't give you medical advice. Our job is to present to you all the information that we have and that we know so you can make an informed decision about your birth, period. And that's our job. We might give you information that maybe your OB might not be willing to share with you, or maybe somebody missed out on, like your midwife, your nurse midwife. But our job is just to give you the information so you can make an informed decision about what you want to do.
Could you go a little bit deeper into that then? What is the difference between a doula and a midwife?
Other than the training that we provide, even though the training I went through had a very midwife feel, and she encouraged us to read books that were about, Black midwives. And so we had to do a lot of training. Just when I talk about the training, just compared to other training, sometimes people think it's kind of intense, the training that I went through just to be a doula. But really, midwives, really on par with doctors, they go through years of training, and they're medical professionals. So they know techniques that we do not know, even though doulas have a lot of knowledge when it comes to certain medical terminology or issues that come up during your pregnancy and postpartum, and things that we know to look out for. But we will recommend you to talk to your midwife or doctor about them. We're not going to prescribe you anything ourselves or try to diagnose you ourselves.
Just to add to that too, I mean, within the birthing process as well, your midwife, your OB is the one that actually gets in there. They deliver the babies, they poke you, they stitch you up if you need to. And we do not do that part. We're there to support you through those processes. Because I do get that a lot too. They're like, oh, so you guys deliver babies? And I'm like, we probably could if we had to, but that's not what we do. So I just want to be clear about that too.
So then let's switch hats just a little bit. I'm imagining that some folks listening right now might be doulas themselves. Let's talk about the marketing, the business side of being a doula. How do you find new clients? How do you decide pricing? How do you, anything around, like the business side of being a doula that you're open to talk about?
I'll go. Yeah. Geez, I mean, again, I think it depends on what your niche area is or what you cover. I definitely offer packages for my clients based on whatever they need. I have some clients that just want prenatal work or fertility work. Some clients want birth and labor. Some clients want postpartum. Some clients are like, I need you there the whole time. I need it all. So it really, and then there's a la carte things that we do as well, like breastfeeding counseling or vaginal steaming is something else that I offer, or the prenatal or postnatal fitness sessions. I'll do that individually as well. But I think it just depends on what you're looking for. All of my packages end up being customized, to be honest. I don't really have a set price for anyone. I also have a sliding scale in case there's somebody who, can't afford the higher range of what I'm offering. And then I do a scholarship every year as well for a mom who is in need or that I would like to support. So I think it's important when hiring a doula, you ask all those questions like, hey, what exactly do you offer? Have them put it in writing for you as well. Having contracts is super important to have, especially during COVID now, because a lot of hospitals are not allowing us to be in the hospital room. At least down here in Florida, that's the case. There's very few that are allowing us in. So having those like clauses in your contract, what you can be there for and what you can't, again, that you're not there to diagnose or prescribe any medication, I think is important. And just being transparent as possible about the business side is really very, very important. And I always say to other doulas, like, don't overpromise. It's so easy for us because we get excited and we're like, oh, I'm going to do this and this and this. But just make sure that what you can do is within your capacity and that you're taking on an amount of clients that you can actually manage and really be there for, because it's really easy to like overwhelm yourself, because we do want to help everyone and take everyone and do all these things for them. So I think it's important to be very mindful of that and just careful about what you're doing. And then having a good network. Like I said, we're a resource. So I think having a strong network is important of birth workers, OBs that you can refer people to, and also holistic practitioners like chiropractors, acupuncturists, massage therapists. I think it's really important to have all that in line as well, so you can offer them to your client if they need them. I hope that wasn't too much. I feel like I rambled on for a while there.
No, that was awesome. I'm loving the details. Iman, anything you want to add on?
Not really. Just, I guess being honest, I would say that I'm a better doula than I am businesswoman. And that's something that I'm continually working on. And I have several packages myself, but I'm always changing my business model to fit the times. Like just now, even with COVID and everything, I'm changing. So I'm staying a student when it comes to business. I wouldn't say that's my strong suit. I have a very soft heart. So I would say that when it comes to business and matching that with my my skills as a doula, I've had several doulas tell me that I need to charge more. So yeah. So I'm still working on it, but everything Nicky said is really basically everything that I do or either I'm working on. Yeah.
Well, I have a little bit of an advantage here because I did work in marketing before I became a doula. So I totally just applied everything I knew to my business. And the marketing is a part of it. But I work mostly off of referrals, either client to client, birthing centers, other birth workers, midwives, again, some of the holistic practitioners as well. And it's kind of just like a network. I've never really advertised outside of like posting on social media, which I'm honestly not that great at. But, but I think also creating a network with your clients is super important. Like I said, I'm very clingy. So I have a lot of circles. I have postpartum circles. I have exchanges. I host little baby shower things with my clients. Like, oh, if you have old clothes and this mom is delivering now, can we pass it along to her? Or any diapers you didn't use? So I think that can be really valuable for doulas out there as well, is to remember, like, once you get the client, you just create the network off of that. And you can really build your business off of just referrals and keeping your circle kind of tight. It feels, very exclusive sometimes to people, and they're like, oh, Nicky was my doula and she offers this and this and this, and you should be with her. So I recommend giving that a shot if you're looking for a way to market like you, Iman, but you're not really a marketer. Just use what's right in front of you, your clients.
Yeah, that's pretty much repeat customers, and then my circle and community. That's really a lot of the business that I do, especially when it comes to lactation and breastfeeding assistance that I offer. It's just, yeah. And then I'm always just trying to get them to write me reviews, because then because I don't like to really tell people too much that, oh, I'm a doula, because I don't want them to think that I'm asking them to be their doula. So when I get referrals, they're like, oh, I didn't know you were a doula. It's like, yeah, I am.
So everybody who's listening, we do have Deej back with us. The fans are happy. They missed you. So glad you're here. So a couple of things we talked about, in case you wanted to jump in and add your thoughts, is we rounded up our conversation on inequity in Black maternal health. So if there's anything you wanted to share about there. We talked about how doulas can be supportive in that role as advocates. And now we're talking about the business side of being a doula. How do you get clients? How do you decide on pricing? Is there anything in any of that? And you can just go on a 10-minute rant on all of it if you want. So we'd love to hear from you if you'd like.
So I think before I exited, I was speaking about the importance of Black mortality and what that means and how we can actually work together to change so we can work together to change what's happening with Black women and the mortality rates. Just to speak a little bit more, I think Nikki was talking when I was here last about how just the teaching and the education is what's needed, right? Right when they are coming into their medical profession, they need to have that training. Being someone who come from that background, there is trainings that go throughout your career where they'll say, hey, come to this 30-minute meeting and we'll talk about implicit bias. And people are zonked out, they're asleep, they're on their phone, they're not really paying attention, or they have been a doctor or a physician or a nurse for so long that it's already in their mind that this is just how they are. And so we need to get to them when they first start their education process, not later on in their career. And so I think that's very important. As far as I'm trying to remember everything you guys talked about. Oops, sorry.
We talked about then the role a doula can play in being your advocate. If there's anything you wanted to share about that.
Absolutely. So I think the huge part that a doula play is that we get to tell our clients their birthrights, right? So we get to work with them and let them know that these are things that you can do. You can ask these questions. You can be, you can go back and forth with the doctor and say, this is what I want. This is what I don't want. You can say, why are you doing this to me? Can you explain this in more detail? I don't understand that. And clients sometimes feel that when they're in the presence of someone who has an authoritative figure like a doctor and someone who has years and years and years of learning and realms of topics, that they are the most knowledgeable. But how can they be the most knowledgeable about your body? It is your body and your baby. So they might have the information to give you on making informed decisions, but they cannot make those decisions for you. And that's what I think is so important. And as being a doula, I'm able to meet them and say to them, no, you can ask them, hey, I've been feeling this X, Y, and Z. My blood pressure is X, Y, and Z. What do you think I can do for this? But they can't say to you, oh, you have to be induced, or this is what has to happen, without giving you the reasons why. And sorry, my lighting is like messing up. It's our power outlets is like messing up. But that is something that is so important to me with my clients, and letting them know that they do have the right to ask those questions, and that it's their body and their choice. And then just about like meeting clients, I think it's so important. This is something I talk about with my other doula friends, is that especially when you are a woman of color, I feel that there's this disconnect when it comes to getting clientele, right? Because there could be someone who is white, and you guys could go through the same trainings, same program, finish at the same time, and it just seems like they are picking up more clients than you. Why is that? And I feel as though that it's like, again, the implicit bias is the bias that is not there. I think certain clients may feel like certain doulas may not be as educated. Like, you get what I'm saying? So, let me find someone who looks like a quote unquote what a professional looks like, right? And so we are looked over. And that's why I feel like it's a huge deal that we as Black women, we reach out and we make these communities and these networks of support for other women of color who are looking for people who look like them. And we market that. Like, we look like you. We know what you're going through. We understand what you need. And then we find that market of women who are looking for those who understand that, who need that. So I think that's how you market yourself. And I think that's what has been working for me, and why I've been, thankfully, alhamdulillah, over these last couple months have seen an incline in my patients, is because I really started to market myself to women who I know need me. And I say to them blankly, this is why you need me. This is why I'm trying to help you. Not, hey, I'm the best doula, I have all the information, pick me. This is why you need me on your team. And that's how I've been able to have this incline of patience thus far.
Deej is back, y'all. That was awesome. Thank you. Nicky, Iman, anything you want to add on to or affirm or highlight that you resonated with that that Deej just shared?
Sure. I definitely understand what you're saying about people who look like you and them being more drawn to you. I definitely agree with that for sure. I think in my case, and it might just be my location as well, because I am in Miami. It's a very diverse city. And I definitely have a very wide, diverse range of clients, white, Black, Hispanic, all of that. And I don't like to go into my meetings with the mindset of like, I'm Black and they might not pick me. I kind of just try and just present the information the best way I can and kind of vibe and be myself. And sometimes I've gone to Meet the Doula nights where most of the doulas are white, and I'll still end up being the one that books the most just because I feel like I'm myself and I just present myself the way I am, whether I'm Black or not. They want to work with me. So I think that connecting with our own, people is definitely very important, because you're right. They absolutely do need us the most, I think, more. But at the same time, I think it's good for us to also just not let that be a crippling effect for us going into it. Like, hey, we're Black. They might not choose me because I'm Black, and just come with the best game that you can, not necessarily overselling yourself and pretending that, you know everything. And again, some of them I don't even vibe with, which we were talking about earlier. It is a vibe. And I've definitely had people interview me and I'm like, I don't think, we're going to have the right connection, and that's okay. But I do want to say that as a Black doula, and to any other Black doulas that are in that situation, like, don't let that completely deter you or prevent you from going after clients who don't look like you, because some of them are in the same situation. There are poor white people too, and poor Hispanic people too, that are marginalized and need help. So I think it's important to keep that in mind. But I do think that has a lot to do with, my location as well. There's just all kinds of people here in Miami. So, it might just be that.
And I just want to say, like, I'm not telling them to go into a situation thinking like I'm less than, but we have to always remember that we are viewed differently. And if you put in this in, or you kind of, what's the word I'm looking for? Where you almost like try to sweep it under the rug is what I'm trying to say. Like how some people say, racism doesn't exist. Okay, you're just sweeping it under the rug. So when you try to pretend, and I think that's the word I was looking for, but you try to pretend that it's not there, you're doing yourself a disservice. If you accept the fact that it is there, and you have that mindset that I understand that I can be affected by this bias, right? Then you understand that it's not me, it's them, right? You're not the issue. You're not the problem. Because I've had doula friends who say to me that they feel like it's something that's wrong with them. And that's not what we want to feel. We want to understand that this is an issue that needs to be addressed and is in a lot of different homes and everything. And that it's not you per se. Because like you said, you could walk into a room and still all the clients, right? No color, and that's fine. But we also do not want to pretend that it doesn't exist. So I'm not want to put fear into people. I just always want to be someone who educate people on what is there, so they're not blindsided when they feel like, I love being a doula, I want to help women, how come I don't get any clients? I'm making flyers, I'm putting myself out there. I started a podcast, a YouTube, I got a Clubhouse room, and I'm still not getting the clients. What is the issue? Is it me? No, it's not you. So I just want to put that out there.
That's awesome. Team, Iman, go for it.
Oh, well, I just wanted to, add on to what she was saying about knowing your birthrights, which is very, very important. Glad you mentioned that. And just another, hot button issue that's been coming up a lot is, medical trauma and medical assault when it comes to birthing people, and your doctor, there's a level of consent that doctors and nurses need to be aware of, and that patients need to be aware of in just when it comes to your birthrights. And so I think that's also something that just needs to be just talked about more.
Yeah, I agree. Just to speak on that a little bit, I had a client who said when she was in labor that the doctor came in and didn't explain anything that was being done, but told her to lay on her back and proceeded to do a cervical check. And she felt very violated. And this is something that I hear all the time. And in that moment, she froze up. She knew that she didn't want this to happen in that moment, but she froze up and she allowed it to happen. And I hear this all the time, that we feel like this person has the authority. They're there to help me and my baby. So let me just let them do whatever they want to do to me. And it's like, that's not informed consent. You didn't tell me what you were doing to me. You didn't ask me if it was okay to do it. You didn't explain anything. And not knowing your rights, this is why this is happening. Because if she knew her rights in that moment, she could have said, excuse me, stop. Or she had a doula. If her partner at the time was educated, they could speak up for her as well, and say, excuse me, she looks like she's in distress. She's having contractions. She's doing X, Y, and Z. Can you guys come back later? Or can you at least let her know what's being done to her? So this is things that I advocate about a lot, knowing your rights, going into that labor and delivery room, going into those prenatal appointments with the most information possible. So I think that's very important.
Team, I would love to continue this conversation. We are getting to the top of our scheduled time. And so we're at that moment where you get to shamelessly self-promote for all the folks out there who want to get to know you, who want to DM you, who want to work with you, who know somebody wants to work with you, or just want to be a part of your world and tell you how much they appreciated what you shared. So who would like to start with your shameless plug? Where can folks get at you and say you're awesome? And I know y'all are super humble, so I'm just going to go in the order you are on my screen. So we're going to start with you, Deej. Where can folks get at you and tell you how awesome you are?
So you guys can follow me on The Nurtured Baby. That's THE.nurtured, NURTURED BABY on Instagram. I have a website, thenurturedbaby.bigcartel.com. On my Instagram is where I am most active. I am posting daily. I post breastfeeding tips, postpartum tips, childbirth. I do lives on there. And I'm active on pretty much all platforms. You can find me on Facebook, Clubhouse, Twitter. It's all the same, The Nurtured Baby. And that's where I give all my information for women, especially women of color, about their birthrights, Black mortality. You'll see a lot of that on my Instagram. And yes, so.
Awesome. Thank you, Deej. Nikki, what about you?
Sure. I'm also on all those platforms under the same handle: Instagram, Clubhouse, Twitter, Facebook, YouTube, which I'm getting into a little bit more. And that's at Thank You, Nikki. And that's NICKY, like a boy, is what everyone tells me. So if you're looking for more information, you can reach me there. I am trying to get a little bit better about posting on Instagram, but right now I've been on the Clubhouse game, which is actually where I found Deej. So, and she does post great content. I got to be more like her, to be honest. That's where you can find me though. And I have a website, which is thankyounikki.com. And you can find out all that I do there and see a list of my certifications and resources as well.
Awesome. That's where I met Nikki and Deej on Clubhouse as well. Iman, your turn.
Well, you can also find me on Instagram and Clubhouse at Iman Seraaj FC. And then on Facebook, you can find me you can probably just look up my name, Iman Seraaj, but if you want to get more into it, FullCircle Doula Services on Facebook. I also have a website, FullCircleDS.com. Yeah, you can, that's where I am.
Awesome. So show notes today where you can find the links, tomearl.com/doula. Let me give this a shot. tomearl.com/DOULA. I'm getting the thumbs up. I spelled it right, y'all. TomMerrill.com/DOULA. We will have everybody's Instagram links in the show notes. From there, DM everybody and say, wait, what were you on Clubhouse? Where were you on this? Team, y'all are amazing. This was so awesome. Awesome. This is everything I want this podcast to be. And words are escaping me because I'm feeling so moved right now. So thank you, each and every one of you, for being here, for sharing your gifts, for the important work that you do, for the lives you save, for all that you do. So thank you all very, very, very much appreciate it.
Thanks, Tom.
Of course.
Assalamualaikum, Tom. Thank you again for having me.
Wa alaikum salam rahmatullahi wa barakatuh.
Thank you.
Of course. So team, our closing ritual is for you to share an invitation with those who are listening. So this is different than the self-promotion. This is an invitation where you want to invite people to be, to do, to think about, to discover, to evolve into, to read, to reflect upon, to advocate for, whatever that is for you. What would you like to invite? What is your invitation? And we'll let everybody, you can self-select on this one when you want to start.
I would like to invite everyone to share their experiences, whether they're good or bad, especially in relation to birth, and not just with other women, but with people who do not have babies, men, your son, your uncle, your dad. I think it's important that we start making this education across the board and normalizing it for all genders and all people. I don't think it should just be like, oh, you get pregnant now, and now we're going to give you all this information. I would really love to see that change. So that is what I would like to invite everyone to do and if you have a daughter, start talking to her about this early. Don't wait until she gets pregnant to share your birth story or talk to her about anything. And that's not just birth. We're talking about periods too, because that's where it all starts. It all starts with a period, right? So I think that's a really good launching point for us to really educate everyone on our reproductive health and be stronger about it. And again, don't be afraid to share your experiences, good and bad. I think as a community, especially the Black community, we really have trouble with that. We don't really share very well. And we keep a lot of things to ourselves. And I think that we need to stop doing that. And if you had a doula, talk about it, post it on Instagram, share your doula with everyone, let them know what experience you got from it, because that's how we're going to start changing the game and making this maternal health crisis start to go away.
Yeah, and I'll just piggyback off of what Nikki said. Like sharing your experiences, getting out there, talking about the things that's important to you, advocating for your rights and other people's rights, and joining support groups. I think that's something that is so, so important, is to have what I call is a tribe. Go out there and find you some people who are like-minded, who share some of those similar experiences, who are maybe going through the same things that you're going through, and find your tribe. I think that's so important.
Thank you.
I would like to invite everyone to explore. So explore your birth choices, explore what you feel your philosophy around pain medication or pain management is, explore your choices around breastfeeding, everything. So that's also jumping into educating yourself, but really just exploring. A lot of women don't know that within their city or state that they have more choices than they thought they did. So explore those.
Awesome invitations. Thank you once again, Iman, Deej, Nikki. I appreciate all you. Thank you. I want to thank you for listening to this week's Deeper Listening, Re-Listening series. I don't know how many more times I can squeeze in the word listening into this sentence. I want to thank you, as I shared in the beginning, for sharing your time and energy listening to this entire episode. As I said at the beginning, I'd love to know, do you know what year this episode was recorded in? And I'd love to know what stuck out to you, what moved you, what questions do you have? And if you have any suggestions for what you'd like future topics to cover or future guests we should feature. My friends, I look forward to you joining us again next week for a new episode in our Re-Listen series. And as always, I'm wishing you peace and blessings. Thank you.
One more thing. I'd love to continue the conversation. Feel free to join me at tomearl.com/join. Subscribe below, or let's connect on social media. Tom Earl Artist. Thanks again for watching.